Thank you very much, Nick. So obviously I can't update on the whole Sowerby research program in the next 15 minutes, so I thought we would focus on the patient access electronic health records work that we've been doing over the last few months. One of our top priorities at the Sowerby Forum is to provide as much evidence base as we can for the integration of electronic health records. And as we know, there's been a large push, both from aspects of the public, the commercial sector, policymakers. We've been hearing that already this morning. And we find ourselves in an era, of course, where we're starting to realise the benefits of innovation and technology in terms of delivering real improvements to the healthcare sector. But what do we actually know about patient access? Where are we now? How can we understand better what is going on at the moment, and how can we use that to inform the wider adoption? Now, of course, patient access isn't new. Patients have long been able to request copies of their paper records. As a practicing clinician, I'm often surprised that doesn't happen as often as it potentially should do. And indeed, patients often opt out of quite simple measures like receiving copies of their clinic letters. There's been a lot of rhetoric at the moment, and indeed again this morning, about the summary care record, and that's an important piece of work, but as we've heard from one of the questions earlier, the data that provides around visibility of appointments, repeat prescriptions, is quite limited. And we know that the vision by 2018 is much broader. Patients shouldn't only have read access to their records, they should also have write access to the records and become the centre for directing their health care. So when we look nationally at where we are in that regard, these are the figures. This is the latest quarter data provided nationally. This is publicly available data. That only 4.5% of GP practices are both enabled and patients are actually utilising the access to the records. And that's quite surprising. And so we have quite a long way to go by the 2018 deadline potentially to reach the 100% compliance. If we drill down more granular, can we start seeing any patterns around who that 4.5% of the practices are? And the answer is no. The practices that have adopted are in green, those in red, as you can see, make up the majority. And we've analysed this by geographical location, size of the practice, number of partners, demographics of the patients, and there seems to be no trends that come out of this data. It just seems to be early adopters. So what I've thought I'd do this morning is just provide you with sort of 3 vignettes of some of the research we've been doing recently, to try and help tease out some of the motivations behind these early adopters and see if we can provide a bit more insight as to where we need to go. And of course, a healthy marketplace is not just about the demand from the patient side, it's also about the supply and the fine balance that can provide. And so we felt it important to assess both the healthcare professional aspect as well as the patients and assess those in parallel. So if you are a clinician or policymaker and you want to look to the literature because you're considering enabling patient access, what would you find? So we undertook a systematic review. This is a review of reviews, so we extracted eligible review articles that looked at the impact of patient-accessible electronic health records. And they had to explicitly describe some qualitative impact of that PAEHR. From that, we extracted outcome measures that were described, and we categorised those into 16 domains. To try and quantify the impact, we then provided a weighting using a scoring system to provide us with some quantification as to whether there really was a positive impact of having access to patient access electronic health records or a negative or no impact. Now, of course, these outcome measures were both, again, from the patient side and from the healthcare professional side. So from the patient side, looking at things like patient engagement, satisfaction, self-efficacy, quality of life, clinical outcomes, all those sort of aspects. From the healthcare professional side, aspects such as workload, confidence from the confidentiality, security, privacy aspect of these electronic health records. So these are the initial findings. I think they're quite surprising. There's a huge variability when you look at the review articles, and of course under this there's a number of independent original papers that we see that there's a positive outcome in terms of the impact between 39 and 88% of the times. Now, of course, some papers are just looking at single impact metrics, and of course some of those may have been selected explicitly to demonstrate a benefit, so there's clearly a potential bias here. To give some context, we look at the bottom paper. There were 200 outcome measures assessed within that review, and so about 100 of those, 50% of them, demonstrated impact. So the inference is that 50% of the times there's a negative or no impact from providing the electronic health records. Another interesting aspect is when we split it down by the patient to the healthcare professional, we see that there is a greater interest in evaluating from the patient's perspective. 375 outcome measures assessed for the patient versus 83 for the healthcare professional aspect. And what is again interesting is that the patients, so from when you evaluate from the patient's perspective, generally there is more of a positive outcome in terms of impact when you're looking at the patient compared to the healthcare professional. When we look at this more granular level, the main driver for a negative impact from the healthcare professional aspect is again concerns around security, privacy, and data sharing. That seems to drive down the positive impact the electronic health records generate. When we released our Sowerby Commission report last year, we created a number of actions that we felt should be priorities to accelerate the uptake of integrated electronic health records. And one of those was around patient access. We undertook a survey to generate some of those recommendations, and this morning I want to present some of the preliminary data for a follow-up survey that's looked both at the confidence and capability of clinicians to data sharing, but also the potential benefits or impact of electronic health records. This survey was delivered across the doctors.net web forum. Responses this time were 350 from secondary care doctors, 150 from general practitioners. This was across England and Wales, so a wide geographical distribution. And the survey was open for 2 weeks in March of this year. Now, of course, one of the cornerstones for generating clinical enthusiasm for patient access, of course, is the confidence in the data and how complete it is. And so the survey encompassed about 20 questions. I'm just presenting a couple of them here. But the first question asked them about do they actually use IT to access data external to their organisation. So if we look to the left of this graph, the two white bars, the left one is GPs from 2013 and the resurvey in 2015. There's about 16 to 18 month gap between the two. We see that nothing much has changed, unfortunately, across the two surveys. That it's about 50% of GPs that are routinely accessing data external to the organisation. More worryingly, thinking about whole systems approach here, it's only about 20% of secondary care doctors that are doing so. 60% are never doing so in secondary care. If we're thinking about patient access, what are secondary care and primary care doctors' views to electronic health records and patient access? First of all, we ask them, do they believe their patients currently have access? 46% of GPs, 20% of secondary care doctors. Do they truly believe that the benefits of accessing these records outweigh the risks? I think this is quite concerning here. Only 25% GPs believe the benefits outweigh the risks. Interestingly, secondary care doctors are up as 37%. Another concerning aspect of this response, I think, is the concern around the workload. I think universally, more so in general practice, they feel that the access would create, I think, a burden in terms of the extra workload that it would generate. So what can we take away from these initial figures? Well, I think, firstly, there's some confusion among doctors actually what electronic health record access should mean and what it should mean from the patient and what the patients themselves should expect. And thinking about the first response, the first question here about whether patients have access or not. Of course, if doctors are going to take a leading role in educating patients and encouraging them to uptake access, then we want to see that figure on the top there nearer 100%, rather down at about 50%. I think the second point to take away from this, I think there's a lot more work that needs to be done in terms of describing the benefits for the healthcare community, and of course articulating that alongside the potential risks and impact, particularly thinking about workflow that I've already described. And it's on that point that we're taking forward some work. We have come up and are further developing a toolkit and a framework that takes a whole systems approach to evaluating the impact of information exchange and patient access electronic health records, both from the usage point of view all the way through to the impact point of view. And this is really important because a lot of what we found from the initial results presented at the outset here from the review of reviews, as I said, that often studies just hand-picked subjectively the impact they wanted to demonstrate the benefit. And of course, what that doesn't do is assess the whole system's impact, or indeed identify where there are big gaps in the whole system. We've come up with 33 metrics. Again, this was based on the evidence. So we've taken an evidence-based approach here to select out metrics that are usable, measurable, and can be used in real life to design research evaluations of information exchange systems that are rolled out locally. And I'm pleased to say we haven't just stopped there. We're actually using this ourselves at the moment to design, and we have designed our own research study, which I'm pleased to say we are about to roll out across northwest London, with an impending rollout of a care information system across northwest London. And we're going to longitudinally, over the next 12 months, evaluate at baseline and then during the process to look, using these metrics, to really look at the usage and impact of what patient access electronic health records are achieving. And that is both with patients having a read and write access. We're looking both from the patient perspective in terms of their views, the clinician's perspective. We are generating a measure from the patients themselves using the patient activation measure, whether they're actually self-managing and engaging more with their healthcare. And we are using defined populations of patients using big data analysis to actually demonstrate real benefits in terms of the health outcomes for patients. So hopefully by next year, we should be able to deliver some good news in that regard. And I'm pleased to say some of the people involved in that process are in this room today. So just to summarise, we've taken 3 approaches here in the last few months in terms of trying to generate a bit of evidence base to try and understand better the potential impact of patient accessible electronic health records. And I think we've taken away 3 messages, particularly from the healthcare professional perspective. I think there still is a bit of clinical ambivalence. I don't think the benefits case has been fully articulated yet. I think there are concerns about the workload and the potential impact on changes to practice. And I think more work does need to be done on documenting and describing the benefits. And of course, that has to be done with a supporting evidence base, and that evidence base has to be generated across the whole system. And of course, what we want to do here is generate real social capital, both for patients and healthcare professionals, so we can really realise the global impact that innovation, technology, and putting the patient at the centre in control of their electronic health record, and what benefits it can deliver for their health, and of course the healthcare sector more broadly. Thank you very much.